Hi and welcome to EHI TV, eHealth Insider's essential news on video. I'm Shanna Crispin and today we're at London's Hotel Russell for the judging of EHI Awards. Now just down here we've got a team of 8 judges. They've been scouring close to 200 entries to decide on the key category winners. Now today I've been speaking with co-founder of eHealth Media and Judge Linda Davison, last year's Health IC champion John Thornbury, and also the NHS's new Managing Director of Informatics, Katie Davis. So firstly, Linda, can you give us a bit of an indication as to what's actually been going on here today?
Well, we've been deciding the winners of the EHI Awards in association with BT. It's been a 2-day process. We took all the people who entered some weeks ago, and the judges did an initial sift of the entries. Then we drew up a shortlist according to the marks that they gave individual entries. And we've been really scrutinising that shortlist and going through to make sure everybody who's on the shortlist is worthy of being there, and picking out the outstanding people who are going to get the prizes on October the 6th.
Okay, so what's the process for actually deciding who those winners are?
Well, in some of the categories we've just had a discussion and the winners seem fairly obvious. You know, someone has sprung out as being the outstanding entry. In others it's been the good old democratic process of ranking all the entries and toting up the marks and seeing from that, you know, who is in front. Sometimes it's very close, really.
Okay, so there have been a few new categories added this year. Can you tell me about those and why you've decided to add those in?
Yes, the first one was most promising IT for GP commissioning, for GP-led commissioning. Obvious topicality there, and really a category to find out what's going on there to support the new commissioning consortia. A good set of entries there. We crossed our fingers a bit and wondered what we'd get, but a very good set of entries that we enjoyed reading. The other one, we replaced the patient and citizen empowerment category with one dedicated to social media. Really, because last year a lot of the entries in that category were using social media, and we thought it would be an interesting exercise to see what the best of the social media entries looked like, and it did prove. We had great fun going through their YouTube videos and Facebook and all sorts of things that people are using in fantastic ways, really. Okay,
so we've got the judging today and yesterday,
yes.
But the event isn't until October. What happens between now and then?
Well, the people who are on the shortlist will be notified and they'll be told that they're on the shortlist. The winners remain a big secret. This afternoon we have Katie Davis, the Department of Health Director General for Informatics, here to help us choose the overall winner, so we have one task left to do. And then we'll be doing preparation for the awards in terms of, you know, all the preparations for the big night, and we'll be bringing everybody forward for that night. If people want tickets, they're still available. Have a look at the awards section of the EHI website.
Okay, now there's also a Health ICT champion category?
There is indeed, yes. Yeah. A very important category that's judged by the readers themselves. So we're going to be asking EHI readers to vote and to get colleagues to vote for the individual they think has made the biggest contribution to healthcare IT over the past year. Entries have closed for the category, so we've got 15 nominations. It'll be 2 rounds of voting. We'll whittle them down to 6 over the next few weeks. So if there's somebody on that list that you want to support, you need to get in there and vote over the next few weeks to make sure they go through to the final round. When we get to that final round, votes already cast will be carried forward, and then other people will be able to vote for those final 6 or transfer their vote over from a previous candidate.
Right, okay. As Linda mentioned, readers have their opportunity to vote for who they would like to see be 2011's Health ICT champion, so if you'd like to have a go at voting for that, please go online. Now, last year's winner of the Health ICT champion category, John Thornbury, is with us today as one of the judges. Welcome, John.
Hello.
Firstly, I'd like to ask you, what was being named Health IC champion last year? What did that mean for you?
Well, it was an honour and a privilege to be named as the Health ICT champion, and it was also gave the indication of sort of the team that was behind me, and it was sort of really their hard work that enabled me to achieve the award.
Okay, so after being involved in this intense judging process, what sort of key themes have come out from some entries you can tell us in general terms?
Well, the key themes that are coming out are sort of the innovation and the hard work that the informatics profession is putting into driving the NHS forward. But I think one of the key elements is the interoperability and connecting all, which is the national sort of process now, and I think that is sort of underpinning a lot of the award entries.
Okay, and what are your impressions of the calibre of entries this year?
The calibre of entries are absolutely outstanding, and it's amazing despite the economic challenges that people are actually working so hard to deliver significant benefits to the NHS.
Okay, thank you. So we've also got the NHS's new Director of Informatics here, Katie Davis, taking part in the judging. Welcome, Katie.
Thank you.
So what does this mean for you to be involved in judging the EHI Awards this year?
Well, it's really exciting for me. I think being so new to the job, it's been a great opportunity to see the wide variety of things going on across the NHS in all parts of the country, and it's been fascinating to see the quality and the level of interest in these awards. So it's been a fantastic learning experience for me.
Okay, so what are your initial impressions from some of those awards?
I've been amazed at the quality, I have to say, and again, as I said before, the variety. It's fascinating because we don't often get to hear about all the interesting things being done, and what's been great to see is the direct impact that some of those things are having on patients and clinicians, really helping the NHS to improve the quality of what they're doing.
Okay, great. Thank you. Now, the winners of this year's awards are going to be announced on the 6th of October at a black tie event in Covent Garden. Tickets are still available, so if you'd like to come along, please visit www.ehealthawards.com.